So I think that how would people differentiate when you say something like that, and aren't you helping the other side by saying that? Because ACA, as I see it, because I lived in this country for 26 years now, that it's not an easy topic here. And people are misinformed, and a lot of people are fearful when hear about their pockets, how it's going to be affected, this tax question, all those. And so ACA, a lot of people see as a step in that direction. In the process, we don't know whether the cost will go up or not. It's just, there's talk about that. There's some estimates on both sides. And so I think that as a strategy, I'm curious to know about what is your strategy with respect to the ACA, how you portray that in public, whether it's actually necessary as part of your campaign to even say about that, because it may be used by the other side. Well, as a proof that we're not the only ones saying, look, people who are for universal health care, they're also saying that it's bad, because ACA is a direct step in that direction.
Well, I will tell you this. To me, universal health care is nonpartisan. And I'm willing to talk to the Republicans who say it's bad, because in a way, I agree with them. There's a lot of bad stuff in it. But we also say the things that are good about it are good things, and we acknowledge that, and we want to keep them, but it does nothing to get rid of the financial barriers that keep people from seeking health care. And that's the thing that it was purported to do. Oh, it'll cover everybody except those 27,000, you know, and now, because of the way it has been, the implementation has been obstructed, the things that were intended about it to be good are not going to happen that way. There's just no logical way that they could, because Congress refuses to fund it the way it needs to be funded. And to me, it would be lying to people that I hope will be single-payer supporters to pretend that it's going to be a solution. It is a step, but it is not a big enough step, and it certainly isn't the last step. So I totally appreciate you asking that question, because I think it draws a point of difference between the single-payer movement and the partisanship that's going on in our body politic today. You know, to me, it's not about being a Democrat over a Republican. It's not about their side and our side. It's about finding the commonness that we all share in being human beings and having a body that's going to need health care, no matter what the policy is. And the final goal is for universal health care that provides access to everybody. And if a Republican is going to help me get that, I'm all for him. I hope that answers that question.
Well done, Sue.
I just wanted to say a couple of things to that too. One has to do with the whether healthcare is a commodity or not, because we live in a market economy, and if we consider healthcare to be a commodity, we don't really choose our illnesses like we can choose a car or a house, and so that's one of the key issues. And the healthcare is a commodity or not, because we live in a market economy, and if we consider healthcare to be a commodity, we don't really choose our illnesses like we can choose a car or a house, and so that's one of the key issues. And the other with the ACA or Obamacare is that it's a government regulating the marketplace. It's regulating the healthcare marketplace, not allowing them to do some of those nasty things like disallow this and put caps on that. But it is not changing the way we finance healthcare. It's requiring us to buy our healthcare insurance through a marketplace instead of having a healthcare relationship with our providers that's between us and them. We have to go through this third party that's got all this financial loophole stuff in it, and that's what's preventing us from getting the care we need.
And what happened there was 4 people that got together and they began studying about it, and now they meet weekly, and it's up to almost 100 people in that group. And then that 100 people go off to their churches and get other people involved. That's what we must do. We've got to keep telling the truth. We got to keep telling them, informing the public of what the truth is. And the truth is the only thing that's going to change this. And one day, there will be enough people out there with the truth that an action will take place. That is Sue's real dream. If we can get it done by 2015. Here. No, really, we have to do one policy because of the class here. Use this movie.
He just said something.
Use a play.
Bob, let me talk. I started the Drive for Universal Healthcare because I had a vision of bringing everybody together over this issue that affects everybody. Anyone who has a body is affected by this, and people are not paying attention to the realities of our healthcare system. So, unfortunately, they're going to have to wait and see as the ACA rollout happens and they don't get what they thought they were going to get, and they find themselves paying more and getting less. Then they're going to start getting angry, and they're going to start getting curious, and they're going to ask questions. Well, if this isn't it, what is it? And hopefully, somewhere along the way, they will have seen a car drive by with "duh" across the door, the passenger door. And we're going to take several trips around the United States. Right now, we're at the end of our first leg, which was 8 states in 10 days. It was grueling, but it was good because we met people, not only single-payer activists, but people who had never questioned about it. They came to see the movie, they got some information that they had never gotten before, and they'll take that information back and they'll talk to their families and they'll talk to their friends and their coworkers. And so slowly, the message will spread. And the important thing, I believe, is that we're not exclusive about anything. We have to talk to people that we think would be against us. We have to engage with our legislators. We have to do our homework so that when we go into the voting booth, we know who we're voting for and why, not just whether they're a Democrat or a Republican. People have been making uninformed voting decisions, and it's time for that to stop. So in terms of your question about defeating the other side of the messaging, I totally own that they're better at it than our side is, but I also feel like we need to wake up, and as soon as we do wake up, there are just as many intelligent, creative people on our side who can come up with effective, motivating messaging. And that's one of my goals. So I hope that answers your question.
He said something. Sorry, I don't mean to dominate the mic, but I've been studying this at length since I've been out of work without health insurance. So another question I have is, how are you going to stop the flow of messaging that began, I guess, back with the Powell Memorandum and with the Cato Institute, with Heritage Foundation? For example, your UAW, I can guarantee you if somebody walked in here right now, they would say, you're nothing more than a shill for liberal progressives. So how do you stop that constant flow of messaging, which is extremely well-funded and obviously is very efficient and is basically taking over our political sphere all the way through from Congress all the way down to local governments. Take a look at Wisconsin, for example. What can we do as, what do we have in here, maybe 20 individuals? When this is a, I guess you could say, an issue that should have 400,000 people sitting in here. So what is the proposal to take back the messaging? Because right now the messaging, especially for corporate media, definitely is opposed to everything that you are standing up for. And I want to make it very clear, I'm on your side.
That film was dated to 2009. We now, of course, are 2013, almost 2014. What kind of systemic changes have been made in Canada, especially concerning the rising cost of healthcare, as compared to, we know that obviously there's a difference here in the United States for obvious reasons, but what is happening in Canada, I read recently that there's an exponential cost increase in Canada that they're having a hard time addressing.
You know, we've been in communication with Bob Evans, who was the economist, the health economist that spoke here about the rising costs. And he's basically been telling us that some of those things that you're hearing are actually mythical. There is a certain rising cost, but nothing like what people have been telling everyone. And that when you have a budget for healthcare and you operate within that budget, there's certain things that you can do to keep costs down.
This is a bill that was not just done in Washington with the legalities. It was done with what patients need. And what occurs with this bill is it's greater and better than the Canadian. And why? Because not only will there be 100% coverage with no co-pays or deductibles after you've paid your taxes, but it will also include basic eye care and basic dental care. What does that mean? It means that when you go to the dentist, if you have an abscess, it's going to be taken care of. If you need a crown or there's infection, it's going to be taken care of at no cost to you. Now, of course, you're not going to get gold in your mouth. You'll get whatever the least expensive is, but your needed health care will be taken care of. How many people have car accidents because they don't have proper eyesight? We need to have a system where people have their eyes checked on a regular basis. And in this movie, it talks about the need of the health care to help the society become a safer and better place. We can do that. It also includes drugs. Not only drugs, but drug abuse and mental illness.
So I'm from Canada, and I think I'm the only Canadian in the group, and also I'm an American. But in Canada, they wanted to include dental and pharmaceutical in the Canadian healthcare plan, and at the time they thought, we better not push it, so they didn't. And they're now regretting that they didn't, because it's really hard to get it back in the long run. So HR 676 is financed in a similar way through taxation, so that you don't actually ever pay anything directly for any kind of medical needs. That's all been paid for out of taxes.
The best healthcare plan is a single-payer plan. Now's the time to finally put it on the table. So grow a spine and finally put it on the table.
Love it.